Now we're going to change gears and start the next panel. And with that, I'm going to invite Clay Wilemon, CEO and Chairman of 4L Data Intelligence, to the stage. He's going to talk about how leveraging AI can help payer and providers.
Great. Thank you. Come on up, team. Good afternoon, everybody. I'm Clay Wilemon, again, CEO and Chairman at 4L Data Intelligence. I'm excited today to be joined by our panelists. We've got Brian Berkowitz, who's Vice President, Strategy and Corporate Development at Lyric, the largest processor of healthcare claims in the U.S. Next to Brian, we have Tanya Dowd. Tanya is Executive Vice President, Reimbursement, Value Generation, and Market Access at PRIA Healthcare. Thank you, Tanya, for being here with us. Doug Farquhar is here. He's the Vice President of Strategy at Reliant Health. And then finally, my friend John Fundingsland down here on the end, who's Head of Healthcare Platform Operations at LTI Mindtree. So a great panel. Our topic today is really around improving value for payers and providers in healthcare, leveraging AI, leveraging artificial intelligence. So for our panel, I'm going to start, guys, with just a quick question. We're not going to do personal bios, where you grew up and what your first bicycle looked like and all that. So let's start with this, though, and we'll start with you, Brian, and that is, what's the most important problem today in healthcare, specifically around payment, whether it's payment integrity or just payment in general, that your company is trying to solve? And how are you viewing AI as a solution?
Yeah, absolutely. So I guess, what I would say is the biggest thing that we are trying to help our health plan customers deal with today and solve for is how do they keep up with the pace of change and the explosion of, all these new care options that have hit the market in the last decade. If you think about things like virtual care, remote patient monitoring, genetic testing, home health, that's a lot of change, and the marketplace is rapidly evolving, and we don't see that slowing down either. And so really our goal is to think about how do we help them understand, what should they be covering, what should they be reimbursing, because that's really hard for them to keep up with that level of change right now. And that's somewhere where right now we're making a big investment in AI to really think about internally, how do we automate our ability to take in all of that new data, new policies, new regulations, and automate that ingestion so that our team can very rapidly create that new content and new rules to help our health plan customers keep up with the pace of change and know in a very real-time fashion what they should be allowing versus not.
Very good. Thanks, Brian. Tanya, how about you? Big healthcare problems you're addressing, and how are you using AI?
Yeah, and our client is really the med tech innovator. So, the med tech innovators bringing new technology to market. So kind of contributing to what Brian said, all of the new technologies coming to market, mainly focused on device, AI tools, digital health. And when a new med tech technology comes to market, it typically doesn't actually have the evidence and isn't in the guidelines to really support its use broadly, because it's going through a 510K process or 510K de novo process, so it's really cleared. Even through the PMA process, right, the FDA is requiring a lower level of evidence. So PRIA Healthcare actually facilitates the prior authorization and claims appeal processes before the case is done and after and post-claim. And make sure that we're facilitating and helping our clients, again, the medtech innovators and their providers, offer these technologies that are valuable to patients and expediting that process. So I think AI definitely plays a role here, and just with our own services, we've incorporated even AI into our processes to make us more efficient.
Very good. Doug, how about you?
Yeah, we are mostly in the cost containment space, and so we think about our sort of three key stakeholders: the plan, the member, the provider, and we want to be able to make reimbursements work for all three key stakeholders, and so using the data and AI to sort of do a better job of that, so that that transaction is fair for all three stakeholders. we think AI can help us do that better, tomorrow than we are doing today.
Very good. So really using AI more to drive fairness for all into that equation.
Yeah, I mean, obviously, I think cost containment, is very much an adversarial relationship, plan versus provider, and obviously the provider is a very important part of the overall transaction, and so, they need to be paid and reimbursed fairly, for not only the service, but the quality that goes with it. And so, those dimensions, AI, helps hopefully us be collectively smarter about what fair looks like.
Right, very good. And John, you're unique. You're working on both sides of the fence, so the payer side and the provider side. What are the big problems you guys are addressing?
Yes, so historically I've been involved in putting people to process, right, in mass. And one of the complexities with payment integrity is the mountains of complexity with data and all the different inputs and all of the different elements that you have to consider to essentially manage the process effectively so that you're satisfying your provider base, but you're also maintaining a good eye on your bottom line, right? And it's really hard to do if you just throw bodies at this. I've had many years experience in India putting people to process and using labor arbitrage as a solution. It's really not that effective in this case because it's very complicated. The process is highly complicated, so you need something else to enable a better throughput, because ultimately you can't get through all of the inventory that you might have with a set of folks. So we need to be able to put artificial intelligence, and that's what we've done. We've built artificial intelligence tools. We've leveraged, the likes of 4L technology, 4L data, and we've put these things in place because it gives us a better capability to process more with less, but use the human intelligence in the right place, in the right location.
Good. That's great. So let me throw out, and I'll start, Doug, really with you, and in terms of, so when we look at healthcare, people often complain about the cost of healthcare. Oh, healthcare, everybody agrees on one thing. Healthcare is too expensive, right? Too costly. So fraud, waste, and abuse within healthcare. So providers of healthcare committing fraudulent, wasteful, or abusive acts, right? Doug, when your company, you service a lot of third-party administrators, self-insured employers, how are you thinking about artificial intelligence for the detection of fraudulent, wasteful, and abusive activity in ways that you haven't historically?
Yeah, I think I sort of look at, historically, it's been more or less a one-dimensional effort in that, you have your claims data and you're doing the best that you can with sort of those capabilities. Whereas, I think AI will just be able to ingest way more data, identify, real actionable areas of trouble. And, it's just going to improve that whole frontier, in a meaningful way, certainly for the health plans and the payers. And again, back to sort of this, I'm hoping that there can be less rub, that it's also beneficial to the providers as well. I think, sometimes the fraud, waste, and abuse, it's on purpose, but a lot of times it's not. And so, collectively, how do we create efficiencies and improve costs and, outcomes so that, everything gets better for, again, back to those three stakeholders.
Good. Brian, you see more claims than anybody. You want to layer on that from a fraud, waste, and abuse detection point?
Yeah, I think what we're really excited about is, obviously AI has the opportunity to ingest large amounts of structured, unstructured data, multiple data sources, things like that. But today, most of the fraud, waste, and abuse work is very retrospective, and it's really, it's hard to move the needle once the claims have already been paid and the dollars are out. It's obviously doable, but less efficient. So we think there's a huge opportunity for AI to really start to detect that fraud, waste, and abuse kind of in real time or right when it starts to happen, to cut off the stream a lot faster. And that's really going to make a very meaningful change in how we're able to keep some of that spend down and pass it back through to members and patients at the end of the day.
Very good. And John, what about from your perspective?
So, interestingly, let's be honest, from a payer to provider perspective, there's a highly adversarial relationship there. And it's not getting any better. And who suffers, right? The members suffer, right? Obviously, we want to get our docs paid. We want to make sure that they can continue to deliver the best care that we can for our communities, right? But the challenge that we're hearing more and more loudly, day in and day out, is that, payers are holding their reimbursements back. There's certain things that are delayed. Why do I have to wait 60 days to get a claim paid on a pretty routine visit, right? Conversely, payers are saying, why are we seeing certain trends from artificial intelligence analysis and basically being able to crunch big data sets? Why are we seeing trends that are not good for us from a financial perspective? So we have to dig deeper, we have to dive harder into why those things are trending those ways, and that causes delays. So you see the challenge between the two parties is becoming more and more egregious, right? And no one suffers more than the membership. But at the end of the day, they both have to do what they have to do. Now, I would never condone ever doing anything inappropriate, right, from a billing standpoint, but certain people are pressed for numbers, right? And that's the bottom line. And so I think we have to manage this through using better technology so it becomes less personal, and it's just hard fact, really driven by data.
Right. Yeah. Very good. And Tanya, when your world, a lot of new technology, so a new medical device, new drug, a big ticket procedure, et cetera, shows up in a health plan, shows up going through the payment process and gets flagged just because it's new or expensive. Quote, air quotes on expensive, right? How are you thinking about using artificial intelligence to reduce some of that friction from a provider point of view with these big ticket procedures?
Yeah, and I think, most of them are big ticket because everybody wants a premium price, right, Clay? So can you support them premium price, right? And I think it really depends on, it's not necessarily my organization using AI, but suggesting to the client and counseling them, and the client, again, being the med tech innovator, making sure that they know who their stakeholder is. And if it's a hospital system is a payer and purchaser in and of itself, right? If it's subject to an employer or ERISA-based plan or a fully insured plan, understanding what the opportunity is to collect real-world data and real-world evidence, which I think AI can absolutely expedite and augment. And I think that's, it's going to happen. Is it happening today? Not completely to the extent we would like it to, but I think there's an opportunity to think outside of the fee-for-service world, right? Because really what we want to have is better patient care and less friction, right, against all of the stakeholders involved, and more expedited processes.
Right. So Doug and Brian, both of you take in a lot of healthcare claims. You take in a lot of claims data. I know, Doug, your company in particular is really focused on just value and creating this good environment for all of the participants. So if you take these big ticket technologies, new technology comes to market, new drug, et cetera, how are you thinking of artificial intelligence to be able to understand better the value of a procedure or an episode of care that's being presented?
Yeah, I mean, I think I guess I'll put on the provider perspective a little bit. I mean, if I were a doctor, I'd be anxious to use artificial intelligence. There's just so much information out there. Even on your best day, can you make sure that you're considering all options? And so, at least from my perspective, the hope is that artificial intelligence allows us to narrow down the best options and then, use your, knowledge of the patient and expertise and so on to, select the best of those narrowed options. And so, we hope that there's, particularly from the plan and the members' perspective, that we're going to see, better care, better outcomes, more from sort of that value-based perspective, the ability to really, that value-based healthcare is, at least from my perspective, a topic we've seemingly talked about forever. Now can we actually really start doing it in a meaningful way? And so that's, I think the promise and the hope, at least from our perspective of, one of the many things artificial intelligence will deliver. Yeah.
And Brian, you've got as much data as any organization on the planet.
Yep.
How are you using artificial intelligence today or in the future? How are you thinking about that from actually being able to deliver on this value-based care promise, or even just better understand, is this claim that's being presented of good value to the plan and to the member of the patient?
Yeah, we're really, so, historically we've sat on a lot of data, and I would say we haven't done as much with it as we probably could have, and, really focused on more of a transactional relationship with our health plan customers. And now, because of AI and ML, some generative AI opportunities, we're really looking to take that data and start to more proactively offer some of those insights to our health plan customers, as well as many health plans are starting to do that on their own data as well, and really think about, how do we get to more of that predictive versus reactive space in healthcare, as well as start to think about the full equation. So historically, our main kind of goal with health plans was to think about, how do we maximize their savings by letting the right claims through and not letting the improper claims through as well. And that was kind of the single variable that we looked at. Now, with using this new technology, we can start to bring in new variables like, thinking about value or thinking about provider abrasion, and start to say, okay, if I ratchet this up, it can save savings, but it's going to cause this provider abrasion, which will lead to this outcome. So it's a lot of, using the data we sit on plus the technology to create a robust set of insights that you can sit with your health plan customer and start to pull different levers and see what the outcome is. And I think that's going to be extremely meaningful as we think about, the provider and plan relationship from a value-based contracting perspective, where they can sit down and do that together and really create more of a partnership that will drive value for the patient.
I'll just add a little bit about population health, right? The population health is a driver to value-based care, and the mechanisms that are built into value-based care that are necessary for a provider to yield results from value-based care are driven by his population, right? And so one thing that's interesting is back about 7 or 8 years ago, I was part of an engineering team that was building a population health solution, and there was zero discussion around AI. There was zero discussion around data aggregation using AI. Zero discussion around the predictive capabilities of AI only 6-7 years ago. Now it's kind of at the center of that. And one thing that we're not really leveraging effectively today, and we're getting there, I think we're at what I consider the horizon of really big things to come with respect to patient health overall, which will ultimately bolster the capability around VBC, and it's better from a payer community standpoint. It's better for the federal government, the state and local governments from a community care perspective, and it's really good for our doctors and our patient communities as well. So kind of an interesting piece there that this is only becoming more and more relevant in the last 5 to 7 years or so.
And definitely with population, looking at the population as a whole, that's so important. But we have so much fragmentation in the system that, the population from a Medicare standpoint may be different than a Medicaid standpoint. So it's really culminating those different payer types and payer mixes together.
Good.
That's a really good point.
So moving on to just, one of the themes that I'm hearing here is that with artificial intelligence technology, and we will drill down a little bit. I ask each of you to drill. When we say AI, that's like saying I have a truck. I got a 4-wheel drive truck, a 2-wheel drive truck, a long truck, short truck, et cetera. So it's a generic term. But if we think about, this ability to see all the data at the same time, which previously, and Brian, you and I have talked about this, is historically the health plans look at claims through a series of layers, kind of like a filter, right? I pour the water through a filter with big holes and then progressively smaller holes, right? And yet with artificial intelligence technologies, we can now look at a claim and all claims at the same time, right? We're not limited to a linear process anymore. This ability to look at a claim and all claims at the same time, and a provider and all providers in relationship around a claim and all claims at the same time, completely changes the ability to understand what's happening around a claim, and each claim represents a person. There's a person on the other end of the claim. So that capability, especially, let's just take the provider side. Brian, from your point of view, the ability to understand the provider that's submitting the claim. Because the provider submitting a claim on Wednesday may be a different provider than we had on Tuesday. They may have been convicted of a DUI on Tuesday. Now they're submitting claims. They may have committed some sort of, gotten a state sanction, right, that previously would have taken months to know. how do you look now at the promise of just being able to have insight into the provider on a continuous basis?
Yeah, I mean, it's an absolute game changer as far as how we think about the claims process today and really moving from kind of that N of one, let's look at one claim and see what's right and wrong about it, and then pass it down to the next thing that's going to decide if that part's right or wrong, and really taking more of a holistic view on things like, you know, provider behaviors, those type of things that have really not been the capacity didn't exist to do that in the past. So we think that's an absolute game changer as far as, you know, when you think about things like fraud, waste, and abuse, or just starting to get ahead of certain trends or behaviors that may be saying, potentially we wrote this policy wrong, and maybe we should go back and review that at a broader level as a health plan. If you're looking at an individual claim, you're not getting that viewpoint. So we think that's going to be a huge game changer. You know, something that we're definitely going to want to try to find ways to help our health plans with that. You know, probably through partnerships. But I think can't say enough about how big of a change that is for the industry.
Right. And Doug, how do you all think about that ability now to literally understand the status of that provider every day?
Yeah, I mean, I guess maybe I agree with what has been stated before. I'll take it from the perspective of the member. You know, I think maybe, again, you know, trying to make healthcare sort of more consumer-driven. Again, another topic, and we've seemingly talked about for quite a while. My hope is that, you know, AI will allow members actually to make better selections. You know, one, maybe narrow down what their issue is, but then, you know, be able to choose, you know, appropriate providers to deal with their, you know, given situation. I look at myself, you know, in theory, I'm hopefully a little bit more of a consumer when it comes to, you know, selecting potential providers for whatever issue that, you know, rises for me or my family. And, you know, I'll confess, I've been just sort of, you know, the soldier that does what I'm told by my primary care physician or whatever, and really sort of, you know, follow the rules of, you know, the plan that I have. And so, you know, I hope that AI allows us to sort of break those chains and, you know, allow the member to be just better consumers of healthcare in a hopefully more efficient way, not only for the plan, but for the provider as well.
Right. Tanya, your customers, so if I'm a medical device company, I've got a great new hip implant, right? And, you know, any of us, when we talk to our friends and relatives, they're going to go have a medical procedure. And what do they often say? Well, I'm going to Dr. X, and you know Dr. X is the best in this market. Nobody ever says, my surgeon's kind of marginal, but we're going to take a shot, right? So everybody's doctor is the best. And so your customers, one of the things that artificial intelligence in this world around paying for healthcare enables is this continuous evaluation of outcomes and quality and cost, right? So quality of outcome, quality of the experience on the part of the patient, and the cost of care. Are your customers embracing the fact that all of this is becoming more out in the open, or are they trying to get the genie back in the bottle?
It's an excellent question, and we only have 5 minutes, so I'll make my comment pretty succinct. The answer is largely no, because, and I heard this theme throughout the earlier talks, think about the reimbursement and market access strategy early. And I always say, would you start training for a marathon the day before? Absolutely not, even if you are a runner, right? Yeah. So definitely understand your stakeholders, what is going to drive them, what resonates with them. So in terms of, you know, really understanding, you know, from a cost perspective, there's pricing transparency regulations out now for both hospitals and for payers. I don't know if anybody's ever tried to look at these files, but they are files that you can't extract right now. So they're not readable by the consumer.
Hard to find first.
Hard to find. I know where they are. I can get you. But you have to literally have somebody who understands how to extract them and read them, you know, to know what they're really saying and to be able to make informed decisions. So I think we're not there yet. Can AI help us get there with these? Absolutely. I think one thing that I counsel my my clients with is, understanding and being able to support the value of your technology from both a clinical perspective first and being able to monetize those clinical benefits is so important. And one hospital A, might have a contract with Humana that's, pays that for that hip implant at $20,000, and hospital B across the street has the same contract and it, pays $5,000. So there's so much variability and so much fragmentation that I think that AI, again, will help facilitate and make that more constant. The other thing I'll say about new med technologies is it's difficult because we're often commercializing, again, with temporary codes, temporary payment methodologies that aren't necessarily easily tracked and or aren't used by the provider because they know they're not going to get paid, right? So it's a catch-22. It's very multifaceted. Again,
right.
I took up a little too much time.
Good. No, that's fine. And we certainly see that on the artificial intelligence technology that we use at 4L Data certainly enables our customers now to see provider by provider, same diagnosis, same procedure, same everything, objectively what is being billed and how providers are testing the limits of what will get paid in real time as well. So as we get to a wrap up here, I'll ask each of you to take 30 seconds, and John, I'll start with you to say, with your customers, say your big health plan customers, artificial intelligence going forward is going to help them make something better, and why, and how will it help it do that? Take 30 seconds.
So I think it'll make the speed to decisions that are right for their business and for their membership more rapid. And that affects the entire ecosystem of care through to membership satisfaction and ultimately to the financial situation that they have to endure, right? Interestingly, I was talking to a small plan in the Midwest, and they said a 3% change in our bottom line figures can take us from being non-competitive in our market to being the number one in our market. And I can't get there unless I can do that rapidly, because I burn up a lot of resource and cost trying to determine what the right decisions are. So I think AI drives that speed, and that's very important for plans. And I know that's number one in their agenda going forward right now.
Very good. Thank you. Doug?
Similar to John, so I think it will create efficiencies really for everybody, and back to the three stakeholders, and hopefully those efficiencies benefit everybody, whether it's cost or quality and outcome, and so I think efficiency is what we hope for.
Okay, very good. Tanya?
I think for my clients, MedTech innovators, it's important that they continue to generate evidence that's going to resonate again with their stakeholders. So I think AI will facilitate and expedite the accruance of real-world data to show the effectiveness of their technologies.
Very good. Brian?
I agree on efficiency, but just since I'm last, I'll come up with something different. I think, two other ones that I think are really exciting is one for potentially the industry to really start speaking the same language using things like generative AI and large language models to say, instead of a provider getting a rejected claim and it has all this health plan jargon and why it got rejected, actually having a way for that provider to understand, why things happen, or a member when they're trying to, understand their benefits and things like that. So I think that's one big piece. And the other one is with efficiency. I think it's going to unlock instead of people spending time on mundane tasks, really thinking more about true innovation in the industry. And that's something that I think the entire industry can really use. So those are the two additional things that I think could be really meaningful.
Okay, fantastic. Well, very good. Well, that is the end of our time. I know for those of you in the audience, if you want to talk with any of our panelists, they've all agreed to stay over there for 10 minutes or so when we get finished. We'll look forward to those conversations. Thank you.
Thank you.